Did you know that nearly 20% of hearing loss cases are linked to medications most people use without a second thought? Imagine taking something that's supposed to help you, only to find out it's slowly stealing your ability to hear. It's a frightening reality that many are unaware of, but it's happening every day. Hearing loss isn't just an inconvenience, it's life-changing. It affects how you communicate with loved ones, how you experience the world, and even your emotional well-being. Certain medications, ones you might be taking right now, could be putting you at serious risk. This isn't just about rare side effects, it's about real, common drugs that could have devastating consequences on your hearing. It's crucial to know which medications have this hidden danger. By the end of this video, you'll be armed with the knowledge you need to protect yourself and your hearing. Because once it's gone, it might be gone for good. Stay with me as we uncover the shocking truth about these medications and how you can safeguard your health. Understanding about ototoxicity. Ototoxicity is a term you might not have heard before, but it's crucial to understand. It refers to the toxic effects certain drugs can have on your inner ear, leading to hearing loss, balance problems, or even tinnitus. These effects can be temporary or in many cases permanent. The scary part? Some of the most common medications can cause this damage without you even realizing it. Knowing about ototoxicity isn't just medical jargon, it's vital information that can help you make informed decisions about your health and protect your hearing before it's too late. Number 1. Aspirin in high doses. Aspirin is a medicine cabinet staple, something we've all reached for at some point. It's trusted for pain relief, reducing fevers, and even lowering heart attack risk. But here's something you might not know. In high doses, aspirin can actually harm your hearing. It sounds surprising, right? You take it to feel better, but if you're taking too much, it could be slowly damaging your ears. The risk is real. High doses of aspirin can cause ringing in the ears, known as tinnitus, and even lead to permanent hearing loss. It's a sobering thought that a common over-the-counter drug could have such serious side effects. If you're using aspirin regularly, especially in higher doses, it's essential to be aware of this risk. Your hearing is precious, and once it's damaged, there's no going back. So talk to your doctor, stay informed, and make sure you're protecting your hearing as much as your heart. Number 2. Certain antibiotics. Antibiotics are lifesavers, no doubt about it. When you're battling a serious infection, they can be the difference between life and death. But not all antibiotics are created equal, and some, like aminoglycosides, come with a hidden risk: ototoxicity. These powerful drugs are used to treat severe infections, but they can also cause permanent damage to your hearing. It's not just a temporary side effect. The damage can be lifelong. Imagine surviving a critical illness only to lose your ability to hear. That's a heartbreaking reality for some patients. The tricky part is that hearing loss from these antibiotics can sneak up on you. It starts with a ringing in your ears, or difficulty hearing high-pitched sounds, and before you know it, it's permanent. If you're prescribed these medications, it's crucial to monitor your hearing closely and communicate any changes to your doctor immediately. Your hearing is too important to risk. Number 3. Loop diuretics. Loop diuretics are often prescribed to help manage heart failure, high blood pressure, or fluid retention. They're incredibly effective at flushing out excess fluid from your body. But there's a lesser-known side to these medications that deserves attention. They can harm your hearing. These drugs work by affecting the kidneys, but in doing so, they can also disrupt the delicate balance of fluids in your inner ear. This disruption can lead to hearing loss, sometimes suddenly and often permanently. It's a shocking possibility, especially when you're taking something to improve your health. The signs can be subtle at first, a bit of ringing in the ears or difficulty hearing certain tones, but these early warnings shouldn't be ignored. If you're on loop diuretics, it's crucial to stay vigilant about any changes in your hearing and talk to your doctor right away. Protecting your hearing is just as important as managing your heart health. Number 4. Chemotherapy drugs. Chemotherapy drugs like cisplatin are powerful tools in the fight against cancer. They can be life-saving, offering hope when it's needed most. But with that hope comes a harsh reality. These drugs can also take a toll on your hearing. Cisplatin, in particular, is known for its ototoxic effects, meaning it can damage the delicate structures in your inner ear. For someone battling cancer, the last thing they need is to lose their hearing on top of everything else. It's a devastating side effect that can happen gradually or quite suddenly. You might notice ringing in your ears, or sounds might become muffled and hard to hear. This isn't just a temporary issue. Once the damage is done, it's often permanent. That's why it's so important to be aware of this risk if you or a loved one is undergoing chemotherapy. Regular hearing checks and open communication with your healthcare team can help catch any problems early, potentially saving your hearing while you fight for your life. Number 5. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs, or non-steroidal anti-inflammatory drugs, are probably in your medicine cabinet right now. These are the go-to meds for pain relief, reducing inflammation, and lowering fevers. But what most people don't realize is that these common over-the-counter drugs, when taken in high doses or over long periods, can seriously harm your hearing. It's easy to pop a few pills for a headache or sore muscles, but if you're not careful, you could be risking more than you think. NSAIDs like ibuprofen or naproxen can reduce blood flow to the inner ear, leading to hearing loss. This isn't just a minor inconvenience. This can be a permanent change. You might notice ringing in your ears or a gradual decrease in your ability to hear. If you rely on NSAIDs regularly, it's crucial to be aware of this hidden danger. Your hearing is something you don't want to lose, so always use these medications wisely and talk to your doctor about safer alternatives if needed. Number 6. Quinine. Quinine is a name you might recognize, especially if you've traveled to places where malaria is a concern. It's been used for centuries to treat this deadly disease. But what many don't know is that quinine carries a significant risk. It can cause permanent hearing loss. This drug, while effective against malaria, can be ototoxic, meaning it can damage the inner ear and lead to hearing problems. Imagine surviving a serious illness like malaria, only to lose your hearing. That's a harsh trade-off. The effects can start with a ringing in your ears, or you might notice sounds becoming dull and distant. For those who need to take quinine, this is a risk that's all too real. If you or someone you know is prescribed quinine, it's vital to monitor any changes in hearing closely. Hearing is a precious sense, and being aware of these risks can help you take steps to protect it while managing your health. Number 7. Certain blood pressure medications. Blood pressure medications are crucial for managing hypertension and preventing heart disease. But did you know that some of these medications can also affect your hearing? It's not something most people think about when they're focused on keeping their heart healthy, but certain blood pressure drugs have been linked to ototoxicity, which means they can damage the inner ear. This damage can lead to hearing loss that might start subtly, with a bit of ringing in the ears or difficulty hearing soft sounds. Over time, these changes can become more pronounced and even permanent. It's a trade-off that many aren't aware of, managing one health issue while unknowingly putting another at risk. If you're on blood pressure medication, it's important to be aware of this potential side effect and to keep an eye on any changes in your hearing. Regular checkups and open communication with your doctor can help you protect your hearing while taking care of your heart. Number 8. Some anti-anxiety medications. Anti-anxiety medications can be a lifeline for those struggling with anxiety, offering relief from the overwhelming feelings that can take over daily life. But while these drugs can help calm your mind, some can also pose a risk to your hearing. Certain anti-anxiety medications have been linked to ototoxicity, which means they can damage the inner ear and lead to hearing loss. This might come as a surprise, especially when you're focused on finding peace of mind. The effects can start subtly, with a ringing in your ears or difficulty hearing certain sounds, but over time, these changes can become more noticeable and even permanent. It's a tough situation, balancing mental health with the potential risk to your hearing. If you're taking anti-anxiety medications, it's important to be aware of this possible side effect and to monitor any changes in your hearing closely. Staying informed can help you make the best choices for your overall well-being. Number 9. Erectile dysfunction medications. Erectile dysfunction medications have helped millions of men regain confidence and improve their relationships. But there's a side effect that's not often talked about: hearing loss. These medications, while effective, can sometimes lead to ototoxicity, which means they can damage the inner ear and cause hearing issues. It's a concerning possibility that can start with a faint ringing in the ears or difficulty hearing high-pitched sounds. Over time, these symptoms can worsen, leading to more significant and potentially permanent hearing loss. It's a tough trade-off to consider, especially when these medications offer such important benefits. If you're using erectile dysfunction drugs, it's crucial to be aware of this risk and to pay attention to any changes in your hearing. Don't hesitate to discuss these concerns with your doctor. Protecting your hearing while addressing other health needs is key to maintaining your overall quality of life. Number 10. Antidepressants. Antidepressants can be life-changing, offering hope and balance to those struggling with depression. But while these medications can help lift the weight off your shoulders, some of them come with an unexpected side effect: hearing loss. Certain antidepressants have been linked to ototoxicity, meaning they can damage the inner ear and affect your ability to hear. It's a side effect that might seem small compared to the benefits, but it's important to be aware. You might notice a slight ringing in your ears, or that sounds aren't as clear as they used to be. These changes can start subtly, but may become more pronounced over time, potentially leading to permanent hearing loss. If you're on antidepressants, it's crucial to monitor your hearing and discuss any concerns with your doctor. Balancing your mental health with the health of your hearing is essential for your overall well-being. Stay informed and take care of all aspects of your health. What you can do if you are taking these medications. If you're taking any of these medications, don't panic, but do stay proactive. Your hearing is precious, and there are steps you can take to protect it. First, be aware of the risks. Knowledge is your best defense. Regularly monitor your hearing. If you notice any changes, like ringing in your ears or difficulty hearing, don't ignore them. Speak up and let your doctor know right away. They might adjust your dosage or explore alternative medications that are safer for your ears. Also, consider getting regular hearing tests, especially if you're on long-term medication. These tests can catch any issues early before they become permanent. Remember, you're in control of your health, and being informed is the first step to safeguarding all aspects of your well-being. Take action now to ensure your hearing lasts a lifetime. Your health is one of the most valuable things you have, and being informed is the first step to protecting it. If you found this information helpful, don't keep it to yourself. Share it with your friends and family. They might be taking these medications too, and you could be the reason they catch a potential issue early. Together, we can spread awareness and keep each other safe. And if you want to stay on top of important health tips like these, make sure to subscribe to the channel. Hit the notification bell so you never miss an update. Your health is worth it. Stay informed, stay safe, and let's take care of each other.